Glad to be here from Rochester in the upstate Finger Lakes area to talk to you a little bit about our work. Similarly, I have instructions. I'm going to focus, but try and sneak in lots of areas that we've been working on. Our focus today is going to be on planning and managing capacity. And that comes from the fact that we came from a health systems agency who formed quite some time ago to do strictly capacity management, but have evolved to a multi-stakeholder group that really works on improvement and lots of different community activities. So we're independent, we're not-profit, sounds familiar from a lot of what you've heard today. We work with multi-stakeholder groups to improve access, quality, particularly to focus on disparities, and we're serving a 9-county area. In our work, we actually sat down once and counted the number of people in the community who are involved in activities. We have over 1,000 people involved in the work that we're doing, 390 organizations, 20 major committees. We work with the community and do analytics for most of this work, so our core work does include data for the activities that are occurring. To summarize our roles, we think of ourselves as a catalyst to bring stakeholders and explore new approaches to healthcare improvement. We bring the people together. It's a community table. So we've just had to remodel to accommodate many more meetings and many more people. We work as the champion, and part of that role is to identify funding opportunities to have these things happen. We work with the stakeholders for their input, but that isn't enough. We go out and so in the past year, when we totaled it up, we were over $30 million in grant dollars flowing into the community to fund the activities that the stakeholders have agreed to work on. And it's our job to kind of push people along. To quote Fran, who I work with, we're the nudge. I'm not the Jewish guy in the group, but I was informed of what that means. So just to focus on particularly our capacity and community health planning activity, we have several groups, and I'm going to touch on at least 2 of those. We have something that's rather unique. It's the Community Technology Assessment Advisory Board. We still do some CON work and actually may not be doing that in the future, but rather working at a different level to inform the state in their activity on that. And I'm going to touch on what was called the 2020 Performance Commission, and I won't get time to talk to you about SAGE, which is actually a project that's planning for the aging of our population so that by 2030, when the baby boom peaks at their need for healthcare services, we will have been working for over 20 years on accommodating that. So a quick review of why capacity might be important. And certainly most people are aware of cost, and there's cost of investment, but there's also cost of driving services. So it's important to recognize that there are other aspects. Quality is also part of planning, and to use a brief example, in our rural areas, there were 5 hospitals with the same populations overlapping that were served who all wanted to put in robotic surgery. And as we looked, there were enough patients to support the volume necessary to maintain quality if one of them did that. And it's important to not waste dollars and decrease quality at the same time. And that's been one area that we've been looking. Access, we tend to focus most on serving populations that are underserved. with our cross-cutting goals to eliminate disparities, planning is incredibly important, and that can be as simple as reviewing with organizations where they're going to put services. When one of the hospital systems was going to put an asthma center that wasn't accessible by public transportation, it didn't make a lot of sense. And fortunately, by bringing that to stakeholders in the community, it changed. And last, we can actually help the systems in our area plan by identifying areas where services are necessary so that we can expand their vision of what their system of the future needs to look like. So the history goes back. As an agency, we actually developed many years back when Marion Folsom, who was the head of HHS under President Eisenhower, came back to his job at Kodak in Rochester and said, you know, we need to do some planning, and was instrumental in developing planning within our community and bringing it to New York State, who's, for those acronyms, CON is Certificate of Need. It's the regulatory control of capacity development. However, that did end. For the large part, Certificate of Need has fallen out of many states. It still exists in New York, but it's changed dramatically. And that's when the Finger Lakes Health Systems Agency really began to expand its focus to community engagement and other activities. In 1993, we established an organization called the Community Technology Assessment and Advisory Board. This is an organization which we man, and it has a board. It's a separate agency within our purvey. And it provides, its mission is to have an independent, professional-oriented appraisal to the community health planning process. It creates advice to the payers about paying for services that are being brought into the community, either new types of service or new capacity. It's to determine whether capacity is warranted. We provide the data, and an independent board comprised of multi-stakeholders reviews the data and develops an advice, a position that the insurers then can take independently and choose whether they want to pay or not for those services. There's a 98% concordance with what CTAB recommends and what our local insurers will pay for. It has to be independent to avoid antitrust, but it's been successful over the years. So what do we review? We set a limit of $750,000 for capital equipment or annual incremental community expenditure. So it might not cost a lot, but if it drives a lot of services, we're going to review it. There are also areas that, because of experience, we review all the time. So it goes from cardiac cath to things like MRI and CT scanners, which we still review capacity for. So what's the result? Looking at the 2011 to 2012, we reviewed 20 projects. That represented $29 million in capital costs for the region. It talked to $32 million in incremental cost expenditures. And with the recommendations that came from the board that limited some of this expansion, we estimate $10 million in savings in capital costs and a little over $8 million in annual expenditures that were avoided by limiting the expansion of those services. The other area I'd like to talk to you about is 2020 Commission. In New York State, there was a review and state legislation called the Berger Commission that reviewed capacity in hospitals within New York State and evaluated the need for those services and had legislative power to close institutions that were not necessary. Within New York State, the Finger Lakes region was the only area where the Berger Commission said, you need capacity. All three hospital systems in Rochester decided they were going to fill that capacity. And through our role in CON, we did batch review for the three hospital expansions. The bottom line is that we took those three expansion proposals, did the data, brought together a multi-stakeholder group that included representatives from each of the hospitals who had applications, but also of the insurers, of representatives from the community, physician providers, and the payer community, the businesses who ultimately foot the bill, and reviewed it. There were 278 beds recommended. The commission had a uniform agreement. It was a unanimous decision to recommend 152. That was accepted by the state. Part of the agreement was that the expansions could occur in the future without re-review by the state if the hospitals demonstrated that they participated in community activity to try and decrease the demand for those further expansions. So the little carrot for hospitals to continue to participate, and indeed they've been actively involved in multiple projects to decrease the need for hospitalizations going forward that are currently showing impact. What was the savings? Well, there's $126 million in capital savings from the decrease in the number of beds expansion, $20 million annual saving in operating costs from having fewer beds come online. Just to let you know, and here's the creep, we're doing other things too. It isn't all capacity at Finger Lakes. We have a $26 million grant that is to expand the patient-centered medical home throughout the community. We're going to support those primary care practices, but we're also going to focus on addressing the social and behavioral impacts on health, because we're going to focus on the triple aim. Those of us in healthcare, I'm a physician, we tend to lose focus that healthcare has about a 10% impact on the health of the community. The rest is those other things, and we're going to have to connect those other things to healthcare if we're going to meet the triple aim objective of improving health. And we're also working on a primary care payment model that's different, so you can bet I'm going to be talking to the folks at Puget Sound as we go on through the day. We also do community convening, and I'd love to go in detail on these, but we have multiple areas. We're working with the employer community on improving high blood pressure control throughout the community and beginning to show impact with that. We have a Healthy Kids initiative to decrease childhood obesity. We maintain both African American and Latino health coalitions to work on problems in those populations within our community. We've convened and have the Coalition to Prevent Lead Poisoning, and indeed have shown a demonstrable impact on lead poisoning in the community. And we maintain a partnership on the uninsured to make sure that people are able to access the alternatives to health care when they're uninsured. When we talk together about what it takes to do this work and why we believe RICs are the way forward, we really think that it's reproducible in community. Talking about planning, talking about the multi-stakeholder process, and serving to help bring money into the community to make the change that's necessary. Thank you.